Right now, looking for those at-home test kits, and plenty want to know tonight on the answer desk, just how accurate are they? Also, do you still need to get a PCR test? We are working to get those answers for you. Channel 3 New Haven Bureau Chief Matt McFarland is live in Hamden to break it all down for us. Matt.
Hi there, Hamden. Well, Aaron, Hamden had a distribution site here at the high school. It was supposed to start at 4, run till 7. Started a little bit earlier because they had so many folks lined up, and it lasted just about 2 hours. That's how long it took them to get through about 1,400 tests. You can see the volunteers with the emergency response team. They are out here right now. The good news is we're told Hamden is going to be getting an additional supply tomorrow, so they'll still be able to hand out more later this week. But that just shows you how hot these rapid at-home test kits are. So many people wanting to get their hands on them, and we're definitely seeing a shift towards them. For the past few days all across the state, we've seen long lines of folks looking for rapid at-home COVID test kits.
At this point in the pandemic, we know enough about these tests and the accuracy of the rapid tests.
But there are still plenty of questions. Francis in Middletown reached out to Eyewitness News asking what happens with all the at-home COVID-19 tests that people take and they show positive. How are they counted into the confirmed number of new cases? The simple answer is they're not. The state's positivity rate, hovering around 24%, is just for PCR test results. But on CBS Mornings, Dr. Michael Minna, an epidemiologist that works with a biotech software company for at-home testing, says right now with the highly contagious, quickly spreading Omicron variant, rapid testing is the way to go.
The appropriate tool in this pandemic to answer the question, do I need to isolate? Am I infectious and a risk to my neighbors? Is using a rapid antigen test.
As for its accuracy, if the line is very dark, you're likely infectious. If the line is faint, you could be at the beginning or at the end. So it's important to get that second test in 24 to 48 hours.
We should really start leaving the PCR test to what it's best for, which is medical, clinical diagnosis by a doctor in a hospital or a clinic, and allow the rapid test to be used for public health to know, do I need to isolate?
In fact, when asked about rapid and PCR testing today, the state's top doctor with the Department of Public Health added,
in many different sectors, we have paused sort of PCR testing requirement and have been using self-testing. And so other businesses could consider that if they are using testing as part of their strategy of keeping their workplace safe.
Again, Hamden says they'll be getting additional tests tomorrow, so these volunteers will be busy later this week. Again, the state says test if you're positive, continue to isolate and wear a mask. And the Department of Public Health's commissioner says if you are showing no symptoms after 5 days, and she says you are continuing to mask, she says there's no reason why then you can't re-engage in society safely under those CDC guidelines. We're live at the mobile newsroom in Hamden. Matt McFarland, Channel 3 Eyewitness News.